Strikes and tough bargaining sessions have become commonplace during the pandemic, with unions in the healthcare sector in particular being hard at work to address concerns in the workplace.
We were just starting bargaining in 2020 when COVID hit, and it did have an influence on not just the way we bargained, but what was acceptable as outcomes of the process as well. We did negotiate additional resources for the psychological impact of COVID.
Job action has been seen across many sectors over the past couple of years, but just zeroing in on healthcare shows how COVID-19 is causing so many different types of strain on workers, including a survey from the Canadian Medical Association showing almost half of doctors are considering reducing clinical work.
We know that burnout was increasing amongst healthcare professionals even before COVID. And then COVID, I think, was really the pressure cooker that put a health system that was already really struggling to the test. And I think what we're seeing is we're struggling to pass that test. You know, everyone on the front line has really rallied over the last 2 years to be there for Canadians, but that work is not ending.
A survey done in BC also shows 1 in 3 healthcare workers may quit in the next 2 years, citing concerns about mental health and wages. In the long run, it's hard to say how long it will take for us to fully recover from this, and not just from the virus, but all the psychological effects stemming from it.
How much disability we will have because of COVID, right? The people hear about the long COVID, but it is going to be some time before we really are able to quantify what that has meant to workforces and workers in various sectors.
In Calgary, Tom Ross, City News.